Hi, everybody. For those of you who don't know, this session is mainly for new volunteers, people who are interested in the program. I appreciate seeing so many of the STS team on board. Might be helpful to answer some questions at the end, so thank you for that. For those of you who don't know me, I'm Susan Layton, and I'm the National Program Director of Survivors Teaching Students, which is a signature program of the Ovarian Cancer Research Alliance. I'm a 24-year survivor of stage 3C ovarian cancer and an 8-year survivor of breast cancer. And the first question I always get is, oh, you must be BRCA positive. I'm not, I'm BRCA negative. Just get that out of the way.
Start working.
I have been doing a tremendous amount of advocacy since shortly after my diagnosis. I'm involved in research advocacy, legislative advocacy, and of course awareness, like all of us are, because we want to see an end to this disease. One program that I dearly love is Survivors Teaching Students. I got involved within it as soon as I heard about it. And I hope some of you will decide today to take the plunge and join us. It's a very exciting program, and it really is one way that we can work toward an earlier diagnosis. If you have any questions, we'll kind of save them for the end. Unless there's something burning and you really want to let me know, that's fine too. Okay. There we go. Okay, so what is Survivors Teaching Students? Well, the goal of our program is to enhance students' understanding of ovarian cancer symptoms and risk factors in order to facilitate an earlier diagnosis. So who do we teach? Who are the students? We take our program to medical students, nursing students, students enrolled in nurse practitioner and PA programs, as well as some of the allied health fields. We've presented for pharmacy techs, we've presented for chiropractors, we've presented in almost anywhere where people will come in contact with individuals who might display some of the symptoms. It's just a good idea to be aware of it. Who are the volunteers? Any person diagnosed with ovarian cancer, fallopian tube cancer, or primary peritoneal cancer, or a caregiver of an individual diagnosed with one of those cancers is eligible to participate. So basically, it's anybody whose lives have been affected by ovarian cancer. And we have a number of caregivers who present. We have teams of presenters, a husband and wife team or a mother-daughter team. So it's really a way to empower volunteers. This is what the team looks like. The National Program Director, which is me. We have country coordinators. We have the program in 4 additional countries besides the United States, and we have various women and individuals helping with country, managing the countries. One that comes to mind, I'm not sure if she's in the room today, but it's Helen Gooden from Australia. We also present in the United Kingdom, we present in Australia, and they have just added on New Zealand. So our program continues to grow. I have regional coordinators. Right now I have 7 of them who take a part of the country, such as Betsy Wallace. I noticed she's on the call today, and Betsy has the Mid-Atlantic region, which includes Virginia, Maryland, all the way up to East Coast to New York and to New England, up in that area. She has Pennsylvania, and they kind of act as my eyes on the ground. They help people get trained, they help recruit people, they work with schools, and let me know of any big issues that are coming up. Then we have what are called area facilitators and on-site facilitators. These are the individuals who actually manage the presentations in the field. They deal with the schools, they get things set up, they arrange the team members that are going to present, and they actually go in and do the PowerPoint and facilitate the actual presentations at the schools or virtually. So they're a really mainstay, and I encourage anybody who's interested, who has a little managerial skill and is not hesitant about using technology, to consider becoming an area facilitator. We always need them, and it's just another thing that you can do that I think you would enjoy. And then our presenters, which are really the backbone of our program. We could not do this program without the presenters. They are the absolute most important part of our team. And I'll show you as we go through what exactly a presentation looks like. I want you to understand the program's voluntary. We do reimburse for travel when we're back in the classrooms. There are guidelines as to how much we reimburse and for how many miles we reimburse. But that's the only compensation there is. This program is done voluntarily. And I've never heard anybody complain about the fact that it's voluntary, because it really does empower an ovarian cancer survivor or their caregiver. It helps them share their story, and it helps give voice to their experience. And it's really a rewarding program. So here's our program by the numbers. Since 2004, believe it or not, we've reached approximately 100,000 students. That's an unbelievable number. Currently, we have 957 active volunteers in the United States and 16 active volunteers in Australia. And that number, both of those numbers continue to grow. I'd like to see the number in the United States go up, but it's been pretty steady for the last 3 years. And the reason it has been is we have a pretty high attrition rate. We lose a lot of members. And then some of our members, I'm really happy to say, they get to be long-term survivors, and they're like, I think I'll take a break. And that's okay too. But so our numbers tend to stay pretty steady, right in that 900 to 1,000 mark. So where are we presenting in the United States? Currently, we're in 37 states in the District of Columbia. Nebraska is on the verge. I've been saying it for 2 years, but they're on the verge. Their team is ready. They're trained. They're all set up for virtual, for in-classroom. They're working on getting schools. And you all know that's the tricky part. And the tricky part is keeping volunteers engaged while we're trying to get schools on board. So if anybody has contacts in Nebraska at medical schools, let me know. Now, we've got some programs that they're kind of in danger of jeopardy. They're kind of in jeopardy right now. I've lost survivors. When we went virtual, things kind of fell off the tracks for some of these programs. In particular, that's Hawaii, Tennessee, New Mexico, and Florida. And what I really need in Florida is I need some women who are willing to step up and be facilitators, women that would help us get a little bit better organized in Florida, that could help our regional coordinator out making contacts. That's what I need in Florida. New Mexico, I also could use a facilitator. Tennessee, we've got a team up and running in Nashville, but I lost the facilitator. I need a facilitator there. The team in Chattanooga has kind of disappeared, so we need them back on board. And we need some school contacts in Tennessee. Hawaii, I need presenters, and I need a facilitator. Now you'll see the list of states where we don't have any program. Alaska is one. I've been trying forever and have not been able to get enough survivors. So if you're on the call and you're from Alaska, let me hear from you. I know you guys have a big survivor presence up there, a very active survivor component. So please let us hear from you. Arkansas, we've had trouble getting a team established there. And then the other ones, basically they have a fairly small survivor base. So if you're in any of those states and you're interested, let me know, okay? And as I've mentioned, we are in those countries. So how are we doing since the pandemic? I'll tell you what, in March of 2020, I was panicked. When they started shutting down schools and we started getting notices of cancellations of presentations, I was panicked. I knew our numbers were going to go down. In 2019, we reached approximately 12,000 students. But the team pulled together, and I'm telling you right now, they did a great job of keeping us in doing presentations. In particular, we switched to virtual. All of our presentations went virtual throughout 2020, and they stayed that way until the 1st of September of this year. I've now given everybody the option of going back into the classrooms in person if they're comfortable with it. But for the most part, the schools are saying, no, we'd rather stay virtual. For example, I know in New York and California, they're staying virtual. Louisiana, I've got a team that is doing in-person presentations. I've got a couple of teams, I've got a team in South Carolina that's doing in-person presentations. But I want to stress this. It's your choice. If you don't feel comfortable going back into the classroom, if you your health doesn't permit it, you're not going to be pressured into going. We'll find another way to do it. We'll either go back to virtual for that school, or we'll offer them a hybrid, or if all else fails and the teams are going back in schools and you can't go, we'll keep you on the list. And when we can go back, you can go back in, you will go back in. So as you can see, in 2020, up until the 15th of September, we had a total in the United States of 6,119. That's up slightly this year to 6,443. And I'm seeing that number steadily grow. And I think the main reason it's growing is the schools are asking us to come back. They're saying, you know, we really need this program. Our students love this program. Please come back. So that's what we've been doing. I hope to see that number continue to grow. As of this morning, I just sent out a link for the 300th presentation. So I know the numbers are continuing to go up. Okay, for those of you on the call who have never volunteered for us, you're probably sitting there going, well, what does a presentation look like? I get calls from women all the time and they'll say, I can't stand up in front of a class and talk for an hour about ovarian cancer. First of all, you don't go by yourself, whether you're presenting virtually or you're presenting in the classroom. Generally, there's four individuals that go. There'll be a facilitator, and then there'll be 2 or 3 volunteer presenters who share their stories. We start every presentation the same way with a pre-evaluation. I want to know how much the students know when they walk in the door. What do they know about risk factors, symptoms, and so forth? Then the facilitator goes through a fact-based PowerPoint presentation that we supply. It's one that our scientific advisory committee has approved. We keep it updated, and it gives a structure to the presentation. Then we have survivors and caregivers share their stories. Follow that by a post-evaluation so we can assess how much they learned. And then we have a question and answer session. I will say this, some of our facilitators will give the PowerPoint up front, everything, just go through everything, and then have everybody share their stories. Others will do a little bit of the PowerPoint, maybe talk about symptoms, and then have a presenter who actually had some of the symptoms or had some different symptoms do their presentation. They tie it all together for the students. The purpose of our stories is to put a face on what we're telling them about the facts of the disease. We are not there to teach them ovarian cancer. From a scientific standpoint, we're there to give them the facts on what to look for, how we presented with the disease, and help them understand what it's like to be someone who's been diagnosed with it. What was our experience? How were we diagnosed? Was it a misdiagnosis? Was it a delayed diagnosis? What stage were we diagnosed at? Those kind of things that help a student understand, you know, when I'm practicing medicine, I need to remember to look for these things. I need to remember this woman and her story. And we hear from students all the time that that's the biggest takeaway they get from our program. They walk out knowing the symptoms that they might not have known before, but what makes them remember those symptoms is thinking about that woman standing in front of them saying, you know, I had bloating for 3 months and I was diagnosed with irritable bowel syndrome. And then I was diagnosed with stage 4 ovarian cancer. So it drives home the point that this is about real people. So that's what a presentation looks like, whether you're doing it virtually or in person. And I will say this about virtual presentations. Students are they're very favorable about it. They really like it. The only complaint we've heard, the major complaint we've heard is it's not as easy to interact for question and answer sessions as it is in classroom. So I know that's a difficulty. and something that we continue to work on. But when we're in classroom, they're fine with that. Okay, so what key messages are we trying to get across to these students? We want them to know that ovarian cancer is the most lethal gynecologic cancer. We want them to understand that anyone born with ovaries is at risk of developing ovarian cancer. The majority of cases are diagnosed in advanced stages. There is no reliable screening test for early detection. When diagnosed in early stage, the survival rates are greatly improved. Factors associated with increased risk of ovarian cancer, factors associated with reduction of risk. Removal of ovaries does not eliminate the risk of PPC, primary peritoneal cancer. We want them to know the symptoms, and we want them to know what to do when they suspect ovarian cancer. What doctor do they need to refer you to? What tests do they need to run? So forth and so on. We're not trying to give them the pathophysiology of the disease. I tell all of my team, and I have them tell the students, and there's a slide in the PowerPoint that says this. This is not your typical class. This is a class to put a face to this disease. We're going to give you the facts, and we hope you'll remember them. And then to make sure that they don't ask a bunch of technical questions that we don't need to be answering, we always tell them, we have a PhD, a personal history of the disease. That's the PhD you have, a personal history of the disease. And honestly, I will see constantly comments about, I think your PhD is much more valuable than hearing from a professor about the statistics of this disease, because I learned more in this session today hearing it from a woman who's gone through it. So that might give you an idea of how it's received by the students. Okay, so you stick up your hand and you say, I volunteer. If you're like my family in the Army, when I was in the Army, they said, don't volunteer for anything. Well, I want to tell you, this is something you should volunteer for because you will really enjoy it. As soon as you contact us, I will put you in contact with a regional coordinator, and she may pass you on to a facilitator, but one of the two of them is going to help you get trained. We have a toolkit of materials through the OCRA website, and you will go through the materials and understand what a presentation looks like, where in that presentation you fit. And then once you've finished reading the training materials and watching an online video of what a presentation actually looks like, we'll ask you to write your story. And I know what you're thinking. Why do I have to write it? I know it. I can tell it. You don't have to have it written. Well, we do for a couple of reasons. First of all, we want to make sure that your story actually conveys the messages we're trying to get across. All of us tell our story. And we tell it so many different ways. I know I can tell mine in a support group, and I can talk for an hour and a half. And I can tell it into a church group about awareness, and I'll probably talk 20 minutes. In this program, you have 7 minutes to tell your story. And you're probably sitting there going, well, I can't even tell them how I was diagnosed in 7 minutes. We help you learn how to do that. We have a worksheet that we recommend you use that helps you, guide you through the process of what's the most important parts of your story to relate to the messages we're trying to give home. And 7 minutes is not a long time, and I get that. And I will get stories from ladies, they'll say, there'll be 15 pages. I can talk fast. Nobody can read 15 pages in 7 minutes, I'm sorry. So we help them get it down to a 7-minute time frame. And we help them pick out the important parts, the parts the students are going to remember, and the parts that are going to drive home the messages. You write it out, you submit the draft to your regional coordinator or area facilitator who's working with you, and they will edit it. Now, everybody hears that word editing and they go, oh no, they're not rewriting my story. Not going to do that. They're not going to change your story. They're going to help you get it down to that 7 minutes. They're going to help you emphasize the things that we need to emphasize. It's in your words, it's your story. And that's very, very important. I don't ever want anybody thinking we have rewritten their story. We are just trying to get your story to convey what we need it to convey. So if you ever have a problem, if you volunteer and you have a problem, you don't like the way somebody's edited anything, send it to me. We'll work through it. It's important that the story stays yours in your own words. Okay? Once you've completed training, your story is approved, you'll submit a new member form, and you're set to begin presenting. And I'd like to say that everybody gets to present just every time they get a chance, but it depends on how many people are in your area, how many people are on the team, so forth and so on. But generally, everybody gets a chance to present at least once a month. So in some areas more than that, in others fewer than that. It just depends. For example, in North Dakota, I know they're going to only do two to three presentations a year, but they're going to try to engage everybody they've got to make sure that everybody gets a chance. Whereas in Michigan, they did over 60 presentations last year. So it's, it just depends on where you're at. And the one thing I will say to you is practice your story. After we've gotten it all approved, even if you don't have a presentation coming up, practice it. I still practice mine, and I update my story. How have things happened for me in the last year compared to how they were 5 or 10 years ago when I wrote my story. So your story is a living thing. You need to keep practicing it. You need to you'll be able to tell once you get up in front of a presentation, in front of a group of students, you'll begin to understand, maybe I could have said this differently. Talk it over with your regional coordinator or your facilitator and say, how can I bring more, you'll understand how you can bring more power to your story. Maybe you need to talk more about your symptoms. Maybe you need to talk a little bit more about the impact on your family. But you'll understand how it is once you start presenting. Okay, we have this thing called a timeline slide. And this timeline slide, I encourage everybody to use. It's a very effective tool. You are going to find that a lot of these students are visual learners. I'm constantly seeing it on the evaluations. They will say, well, I just listened to you guys talk and I don't remember anything. So if you could give me some pretty pictures, I could understand it better. So we came up with this timeline slide, and I want to thank Helen Gooden out of Australia because she actually started this with her team and it was so effective. So we brought it here, and your regional coordinator can work with you when you're in training to develop one. This one happens to be one that I have used in the past for me. I'm just going to go ahead and populate it. And you can see across the top, it talks about the dates, the most significant dates for my story. And you'll see that rather than a picture of me, I put in a picture of my grandchildren. That definitely signifies hope for me. And this is just a tool I put up. I talk about it. I don't talk to it. In other words, I don't just sit there and read it. My story is, I can do it in 7 minutes. Let me just hit the highlights. I'm not going to do the whole full 7 minutes for you, but let me just kind of give you the highlights. I start out by introducing myself, and I talk about my symptoms, that I had bloating, back pain, indigestion. And then I tell them that I went to the doctor. I was treated for irritable bowel and for indigestion. And I stayed on medications for 6 weeks, and I went back to the doctor and I said, you know what? Not working. What else have you got? And he switched my medications, and he said, if it's not better in 6 weeks, come back. Well, a week later, I was back in his office, and he said, well, you're that age and you're kind of overweight, and your mother had gallbladder disease and your sisters had gallbladder disease, so you have gallbladder disease. He said, so let's go get an ultrasound. I had an ultrasound, and the following day I went to see a gynecologic oncologist because they had found a couple of huge masses in my abdomen. And I had surgery 2 days later, and I was diagnosed with stage 3C ovarian cancer. So that's where you would understand, a student would say, oh, wait a minute. I remember seeing a woman who complained of being bloated and so forth and so on in clinic, and they make the connection. They say, oh, those are symptoms. I need to think about ovarian cancer and not just dismiss it as irritable bowel syndrome, or not just dismiss it as gallbladder. So that's the way we make the point. We all talk about our symptoms. Then I go on to explain that I was suboptimally debulked. They only got about 60% of the tumor. I had 6 rounds of chemo, and then I was pronounced no evidence of disease. Then I would go on to talk about recurrence. And of course, recurrence is a very big issue in our population. And along the way, I would mention that the only risk factors that I have are the fact that I, at the time, was very overweight. I was still fairly young. I was only 48, and we all like to think that's young. I also had no family history of ovarian or breast cancer. So then I will talk about my recurrence and how that transpired, and along the way I will continue to make the point. Had I been diagnosed at stage 1 or 2, I likely never would have had a recurrence, and it never would have happened this way. So anyway, I go ahead and I talk through it. I talk through the surgery I ended up having after several years, and then the fact that it put me back into remission. And then I mentioned that I had breast cancer, and I also mentioned that I did not have a genetic mutation. So that makes another point that, there are risk factors, but not all of us have the same risk factors. And then I usually will end my story with the fact that I'm one of the fortunate ones because I'm a long-term survivor of stage 3C. I've been fortunate enough to see my daughter graduate college, get married, and have the birth of my 2 perfect grandchildren, and I've had 24 additional years of enjoying my life. So what I have done in my story is take them through my symptoms, take them through the lack of risk factors, take them through the impact on me as a person, what it meant for me. I went through almost 13 years of surgeries and chemotherapies and scans and everything being put on hold for quite a long time. So it really puts a face to the disease, and it's really important. So you'll be able to get a timeline slide like this, and you can usually do it in 1 or 2 of these slides, and you add some pictures. Now the students are always asking us, I want to see pictures of your CT scan. I want to see your lab results. I want to see this. No, we're not there to teach them the disease. We're there to teach them the impact on us. So I like to see personal pictures, happy times. Some women will put up a picture of themselves in chemotherapy, whatever you're comfortable with sharing. But you don't need to be sharing the medical imaging, so forth. I've had a couple of women put up pictures of their surgery, and I don't encourage that. I encourage you to talk about the emotional side using these slides. You talk about the physical, but you don't have to show them the details of it. Okay, I know this is running short, but I just kind of want to give everybody a chance if you have some questions. In your welcome packet, you will have seen these postcards. These are our new recruitment postcards, and they talk about the program. And on one side, it talks about how to contact us. And I definitely hope you to call us or reach out to us so that we can get you involved. We are going to be starting a new virtual team. We have a couple of online nursing schools, and we're going to try to reach out to them. They're national schools, and I want to have a group of women who only present virtually. And those will be presenters who aren't affiliated with any of the local teams. People, for example, people that live in South Dakota, people that live in Idaho and Montana and Wyoming, who live in the rural parts of South Alabama and South Mississippi, and they can't go to a school because there's no school in the area or it's just too far for them. We're going to have just a virtual team of those presenters, and I'm going to have one regional coordinator over that to run a virtual team. So if you're sitting in the middle of Idaho and you're thinking, oh, there are never going to be enough people here, or you're sitting down on the Delta in the Mississippi, let us know. We can try to get you involved this way. We're going to find a way to get your story out there. And I will tell you, once again, this is the most empowering thing you can do, is to watch these young students walk out of a room realizing exactly what ovarian cancer is and how it impacts our lives. When I presented at the University of Alabama in Birmingham, which is a couple hours south of us, I presented there oh, it's been probably 5 or 6 years ago. And a couple of years later, I was walking across the lobby going to see my oncologist, and this young man in a white coat ran up to me, came tearing across the lobby and said, hey, you, hey, you. And I thought, who the heck are you? And he said, I have to talk to you. And I said, why? He said, well, I sat in one of your classes, your survivors teaching students classes. And he said, just a couple of weeks ago, I was able to diagnose a woman with ovarian cancer stage 1. And he said, I know I was able to do that because of the stories you guys told us in that class. He said, that class stuck with me more than any lecture I had in medical school. Because when she walked into my office and she said, I've got bloating, I've got back pain, I'm having urinary frequency, I'm full constantly when I eat. He said, it just clicked. He said, I saw your faces in my head. And I said, well, we're going to add a CA-125 and we're going to add a transvaginal ultrasound. And sure enough, we caught it at stage 1. So that's what this program means for the ovarian cancer community.